So kidney stones is a very common pathology. Believe it or not, most stones will actually pass without any intervention. Pain medication can be given, and you might just have to pass it at home if it's small enough. In other cases, if the stone is causing constant pain, like it is to Pepe, we can have other terms of intervention that include surgical. So there's some other symptoms that could lead us to just do surgery. That would be if the stone is too large to pass, if it's taking too long to pass, or if it's causing constant back pain, or if it's blocking the urine flow, obviously, and that could cause a urinary tract infection. So some of the ways that you can solve this problem would be extracorporeal shockwave lithotripsy. This is going to be using an external machine to give shock waves that break up the stone. You'll be put under when you do this, and it's relatively painless. You won't feel anything, and they won't have to open you up at all because they'll just be doing this externally, just placing something on your outside of your skin next to the stone. Then there's other options such as percutaneous nephrolithotomy, and that's used if you have something like a staghorn stone, which is the huge stone we discussed earlier, and that can be where they do an incision in the back and they go through that incision right to the stone and either try and slowly break it up or remove it from that way. And then there's another more common way to get this stone out, and that is ureteroscopic removal, in which a ureteroscope is going through the urethra up to the bladder, and there it can either break up the stone or it can just grab the stone and bring it out with it. So you have those 2 or 3 options to solve your kidney stone. But also to prevent kidney stones in the future, you've learned some ways to prevent those. What are those?
Yes, doctor. Thank you for showing me. Obviously I'm gonna take in more fluids, more liquids.
Yes, 2 to 3 liters per day.
And I appreciate the list you gave me with the phosphates, oxalates, and the calcium products. That way I can limit those.
Limit intake of those.
And also I got to limit my animal proteins, so no more red meat, no less chicken,
Just
less
less,
fish,
yeah. Just limit everything. So that's going to be our show today. I know Pepe learned a lot about his situation,
yes, I
and
did.
I hope everyone learned a lot about kidney stones.
Thank you, doctor. I shall be showing Pepito Jr. as well.
Thank you very much.